The McMurray test evaluates the knee for meniscus injuries. The patient lies supine while the examiner passively flexes the knee to approximately 90 degrees. The examiner then medially rotates the tibia and extends the knee to stress the lateral meniscus, followed by external rotation of the tibia with knee extension to stress the medial meniscus. You can palpate the medial and lateral joint line. A positive test is indicated by pain, snapping, and/or clicking. Sensitivity is 16 to 50%, specificity 94 to 98%.